In this video, we are going to be discussing about the job that will be very important for 2023 and onwards. Thus, it can help us making important career decisions in our life. Folks, welcome to 2023. I'm Dr. Mia from Dr. Mia's Straight from the Gut channel. To qualify for today's job discussion, it had to meet several criteria. Number one, it had to be non-physician job because we know that physician career is great, but it's very, very long and very competitive and very stressful. So it has to be number one, non-physician job. Number two, it has to be healthcare related. Number three, it has to have a upward trajectory, both in salary and prestige. Number four, it had to have very high amount of job security. Number five, it has to be versatile and universal demand. That means these jobs should be in demand not only in one part of the country or the United States, but these jobs should be in demand all over the world with the same kind of upward trajectory. So number one in this job category is nursing. Nursing is an exceptionally demanding job, but also this job is in very high demand. And with the demographic changes in United States, even in other countries, including China, Europe, even third world countries, people are just getting older. Nobody is getting younger. Nursing jobs in United States, according to Bureau of Labor Statistics, is going up by 12% or 15%. But I think these are terrible underestimation. The real demand for nurses are going up 20% or above and in all different fields. And we are going to discuss those things in next video. The next important job, number two important job with high demand in my views, being a physician, is the job of CRNA, Certified Registered Nurse Anesthetist. Although it's a long schooling, and the criteria for this is that you have to be a nurse first and work in ICU, intensive care unit, for 2 years. Then you can go to anesthesia school. It's considered to be PhD equivalent. It's a long schooling, but at the end, what remains for you is very, very lucrative. CRNAs are in very high demand. They can choose their lifestyle, either outpatient or inpatient. They don't have to be essentially working in hospital. With the explosion of ambulatory surgery centers, they can just do 9 to 5 job without doing any weekend, and their salary in many instances is a lot higher than a lot of other physicians. For example, like family practitioners or pediatricians, CRNAs earn more money than them with a better lifestyle and by going into less competitive school than medical school. Number three in this criteria would be technician job, like pharmacy technician, who assists the pharmacist in filling the medication, distributing the medications. Although pharmacist has to do the job, again, pharmacy school is very long, very competitive, but you could become a pharmacy technician and do the job of assisting the pharmacist. It varies little bit according to state how much delegation could be provided, but again, it's a very lucrative job, and you can choose for an outpatient job as opposed to in the hospital job, although you could choose a hospital job, and very good job security and salary is on the upward trajectory. Next job that fulfills this criteria will be nurse practitioners. Nurse practitioners could be a master's or could be a PhD course, but with the explosion of the demand of healthcare, they are being utilized very widely. Although some people consider them to be mid-level, you can work as independently or you can assist the physicians and work under their delegation, which is probably a lot safer and a lot more secure. And you can choose an outpatient life, or you could be employed in the hospital, or you could be employed by the insurance companies. And nowadays primary cares are being bought up by the big companies like Optum and similar companies, so you could work for them, and the salary is very high as well as the job is very lucrative. Next job category that comes to my mind is anesthesia assistant. These are considered master's degree level programs where you help the anesthesiologist into anesthesia providing. Although these are upcoming and varies according to which state you practice, how much you can do, but these are again lucrative job. You work under an anesthesiologist. You are not as lucrative as a CRNA, however, still you can earn an honest, decent salary with great prestige under the anesthesiologist. The next number, I'm going to put various different skill job category, healthcare related, lumped together. These are different technological programs. For example, radiology technician. Among radiology, again, you can specialize into just a regular radiology or x-ray or ultrasound or MRI or CT scan. Again, these are long schooling, and after you get your basic qualification, you can continue to develop your skill and specialize into these things. In addition to that, the other job categories, including respiratory therapist, physical therapist, speech therapist, continues to be on high demand and will be so for near future to come. Overall, the job prospect for healthcare is really good, and if you like to work with people, if you like to work with sick people, or if you like to work in the hospital or in an outpatient environment, these are good careers for you. This has been good career in the past and will continue to be, and the demand is just exploding, not only in United States but all over the world. So best of luck in 2023. Hopefully this year will bring new luck for you and new commitment. Remember, without commitment there is no luck. So best of luck means best of commit. Take care, guys.